everyone, student Dr. Siddiqui here. Today we're going to learn about 4 impulse control disorders. These are intermittent explosive disorder, pyromania, kleptomania, and trichotillomania. Alright, so let's dig in. What's the first disorder? It is intermittent explosive disorder. So what is this? It's basically a inappropriate, violent act that is out of proportion to a stressor. This tends to be more common in males in their 20s, and as age increases, their symptoms decrease. An example of intermittent explosive disorder would be road rage. And diagnosis is clinical for this disorder. Treatment is SSRIs, mood stabilizers, or group therapy. So this was intermittent explosive disorder. Now let's move on to pyromania. Pyro refers to fire, so these individuals like to set fire, whether it is to reduce anxiety, for pleasure, or sexual arousal. And what you have to do in the diagnosis of this disorder is to rule out arson. So if somebody purposefully sets a property on fire for the purpose of either harming an individual or as secondary benefit, that is not pyromania. Pyromania is when they set fire because of either pleasure or to reduce anxiety. And the only treatment for this would be to send these individuals to jail because what they're doing is illegal. Alright, so now let's move on to kleptomania. Kleptomania is basically petty theft. These individuals steal small items in order to reduce anxiety. For example, an individual sees an object that basically causes anxiety to them. So then they steal that object, and that leads to reduced anxiety. Diagnosis is, in order to diagnose this, you must rule out theft. And treatment would be SSRIs or cognitive behavioral therapy. Alright, our last disorder is trichotillomania. Pretty fancy word, but all it means is a hair pulling disorder. So these individuals pull their hair in order to reduce anxiety. This is common in females in their early 20s, and what you see in the clinical setting is hair in varying lengths because they're constantly pulling, and they pull at different areas of their head, so they're at varying lengths. In order to diagnose this, you must rule out a fungal cause, so like tinea capitis or any other fungal cause of hair loss. So you do a KOH prep, and also you want to rule out alopecia. Treatment for these individuals is SSRIs, which is basically serotonin reuptake inhibitor, and that's used for a lot of things such as depression and anxiety and all sorts of disorders. And in these individuals, one interesting thing is you must follow up with certain individuals for a thing called a bezoar, which is just a hairball. So what some individuals do is when they pull their hair, they swallow that hair, and that hair basically becomes a hairball in their intestine and causes intestinal obstruction. So what you would do is a KUB, which is just basically an abdominal plain film x-ray, in order to see that hairball or a bezoar. Alright, so let's recap. What did we learn today? We learned about 4 impulse control disorders, which were intermittent explosive disorder, pyromania, kleptomania, and trichotillomania. Thank you for tuning into this video. If you liked it, please give it a thumbs up, and if you haven't subscribed already, please be sure to subscribe and leave your comments down below.